Hi, my name is Dr. Ken Chang, and I am Chief of Gastroenterology and Hepatology and the Director of our Comprehensive Digestive Disease Center at the University of California, Irvine. The title of this article is High Single Pass Diagnostic Yield of a New 25-Gauge Core Biopsy Needle for EUS-guided Fine Needle Aspiration Biopsy in Solid Pancreatic Lesions. I've been performing and developing EUS-guided fine needle aspiration for almost 25 years now, and we've used various types of needles in various sizes. Recently, Cook came up with a novel design for the needle called a Procore needle, and this design includes a side port which is beveled. The initial Procore needle was a 19-gauge needle with excellent results coming from our European colleagues. Soon after that, the 22-gauge Procore needle also showed very good results. When thinking about needle sizes and designs, it's important to remember some key concepts. One is, for cytology, blood is bad. So if you have a lot of blood contamination on your aspirate, it decreases your diagnostic yield. And we've discovered that the smaller the needle caliber, the less blood, and therefore the better cytologic yield. So the 25-gauge FNA needle, in our experience, seems to be the best for getting the highest cytologic yield. However, for histology, larger is better or bigger is better. And the larger caliber needles are able to capture the larger core specimen. In addition, with the side bevel design, the Procore needle side bevel, I think, acts in two ways to enhance the acquisition of core tissue. One, I believe it is acting as a vent, a side hole, allowing tissue to move into the needle with greater ease. Secondly, the side bevel, I believe, acts as a cheese grater, allowing longer specimen to be sliced off the tumor into the needle. So the thought of designing a new 25-gauge Procore needle really comes from the idea of trying to combine these two attributes of optimal cytology with the smallest possible caliber needle, but also to obtain histology with the side bevel. In this study, we studied 50 patients with solid pancreatic lesions. Our results showed that the cytologic yield on just a single pass was 83%. On 2 passes, it was 91%, and on 3 passes, it went up to 96%. Our results also showed that the histologic yield on just a single pass was 63%, with 87% on multiple passes. When we looked at the combination of cytology and histology, combining these two attributes, we showed that the single pass yield was 85%, and it was 96% with up to 4 passes. And we've optimized our technique to what we consider as best practice. Let me demonstrate that for you. Okay, so we're going to go ahead and do FNA biopsy with the 25-gauge Procore. Needle just went in nicely. Okay, so Emma is going to start pulling. Okay. We're going to make nice, gentle to and fro. We'll try to do a fan-like distribution to and fro. Emily's moving back slowly with the stylet as I push forward. The stylet is moving out. About 10 to 20 to and fro. And a fan-like distribution. We call this the stroking fan. Okay, we're going to go ahead and push the needle out. Okay, and we're going to advance the stylet. So we're just pushing the stylet and advancing the specimen through the tip of the needle. Here it comes. Oh, look at that. Amazing core. Okay. This is great. Okay. What you see here is all of this is actually microcore, a little bit of blood, and here is actual core. Here's core. This is a long piece of core right here. You can see that? And that's core. As we open this up a little bit, oh, there's a long piece of core right here. Long piece of core tissue right here. A little bit of blood and some microcore in here. So what we have is microcore in here, actual core that I'll be able to lift up here that I'm going to put in formalin, and maybe some here. This has some height, this has no height. So this microcore, we'll go ahead and smear. This macrocore that has height that I will be able to lift and put into formalin. And here is just a little bit of blood and microcore. Okay, so what I've done is I've lifted up the actual macrocore and placed it into the formalin. And what I have left is microcore right in here and as well as here that I'll be able to smear. So now I'm going to put the second slide on top. You see, as I do this, this is where the microcore is. This core is a little bit thick, but probably thin enough to be made into a slide. So all of this is microcore. Okay. So as we take a look at this, there's a lot of cells on the specimen. These are all small little microcores. Up in here, lots of microcores. This one is maybe a little bit thick. It was close to being a macrocore, but it should be okay. So all of this is very, very good, very cellular yield. We're going to put one specimen for the air dry, which will then go for the diff quick. The second one will go into alcohol for the pap smear. On this first and only pass, the cytology was positive for adenocarcinoma, and a true histologic core tissue was obtained. Okay, here we are. We're right in it now. Okay. We're going to lock jam again. Okay. Yeah, I'm literally moving that away from the diaphragm. All right, that's good right there. Okay, good. Oh yeah. Oh yeah. This is the one. We got this baby. Okay. Okay, so looking at this one, there's some microcore here. You see this white material that moves around? That's actually some core. If you look way over here, there's some core, actual microcore. Look at that. You see that? That's really good specimen right in here. That's really good microcore. Okay, so in this pile there's some blood and there's some core that has some height. So I'm going to put this into formalin. Over here there's some microcore without much height. You can't pick this up, but it's going to make an amazingly good cytology, both from here and from here. Taking that blood plus core and I place it into the formalin over here. Okay, now let's look back right in here. And again, this is all pure microcore in here. And now I'm going to go ahead and make this smear. Oh yeah, okay. Okay, so what we can see on the smear is just abundant tissue right in here, 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 here. Lots of great diagnostic tissue. Cytology showed a metastatic neuroendocrine tumor, and histology revealed a true core, which was positive for insulinoma. I think the next step is to actually do a head-to-head comparison, comparing this new 25 gauge Procore needle with standard 25 and 22 gauge FNA needles, and look at the comparison yields. I think we should continue to refine these needle designs for optimal cytology and histology, and I think we need to continue to refine and optimize the technique for EUS-guided fine needle aspiration biopsy.